Welcome to part 1 of your journey, the post-op full fluid diet. At this point, you might be feeling great or have a little bit of pain. You may either have the same energy level you did before surgery or feeling fatigued. You might find that eating foods during this phase is fairly straightforward and everything is well tolerated, or you may have difficulty tolerating even just a few sips of water. It's important to know that there's a wide range of normal, especially in the first few weeks after surgery, and that everyone reacts differently to it. Your pain will subside in the next few days, your energy should improve over the next couple of weeks, and tolerating liquids and foods will improve with each day that passes. It's important to take this time to listen to your new stomach and slowly learn what it's comfortably able to tolerate. Your stomach will be very vocal, so all you have to do is take the time to listen and adjust accordingly. There's a lot going on inside of you right now. Your body is repairing itself on the inside, your gut hormones are drastically readjusting, your body is being deprived of energy from calories, your blood sugars are readjusting, and your blood pressure is also trying to find its new normal. So it's a real shock to your system. Remind yourself of all of this if ever you have moments of feeling down. It's not uncommon to have moments of regretting your surgery in the first few weeks after surgery. Know that what you're experiencing is just temporary and it will get better. Before you know it, your energy is going to skyrocket, you'll be walking quicker than your kids or your partner, and you'll begin to sleep better. There are two main goals that you need to keep in mind during the post-op full fluid menu: staying hydrated and eating enough protein. Goal number 1, staying hydrated. The most common reason for emergency room visits after bariatric surgery is a result of dehydration. It can be a challenge to drink enough because of how drinking feels now. You can't chug a bottle of water at noon after realizing you've had nothing to drink all morning. Your fluids might just come right back up. For this reason, it's important to start sipping on liquids first thing in the morning and all day long, even if you don't feel thirsty. Remember to take very little sips at a time, or as much as you can tolerate without feeling discomfort. If water feels uncomfortable, like a rock hitting your stomach, play with the temperature of your water or add a flavoring. For example, see if you notice improvements with room temperature water, cold water, or warm water in the form of tea or decaffeinated coffee. Some people find bottled water easier than tap water, so you can try this as well. If you want to try a low-calorie flavored drink, use a low-calorie water enhancer or a low-calorie sports drink. Aim for drinking between 6 to 8 cups of liquids a day. This may feel like a lot, but remember that all liquids count, so don't forget to include your protein shake, soups, and smoothies in this goal. And remember to drink even if you don't feel thirsty. Make sure you always have a glass of water within arm's reach wherever you are in the house, and to leave the house with water in hand. Some patients find it helpful to set timers on their cell phone or microwave timer at each hour of the day to remind themselves to drink. Our app can help with this as well. So remember that for hydration, the key is to start drinking early in the day because you won't be able to catch up on this later in the day as your stomach simply won't accommodate for all of this volume. Goal number 2, eat enough protein. With a much smaller stomach comes less food, making it difficult to get in enough protein if you're not really being intentional about it. Protein is an important building block for every single cell in our body, from our hair to our nails, right down to our blood cells, bones, and internal organs. Your body needs to be fed protein every single day because we can't store protein in our body or keep reserves for when it's needed. If you don't consume the daily protein that your body needs, your body will begin to break down your muscle in a desperate attempt to get the protein. Research shows that there's a lot of muscle loss after bariatric surgery, especially in the first 3 months. It's tough because this is a time when eating enough can be a challenge and most patients don't have an appetite at all. Start the full fluid menu as soon as you leave the hospital or when your surgeon says it's okay to start this texture. You'll notice that there are also lactose-free and gluten-free versions of the menu made available to you. Your goal during the 2 weeks that you're on the full fluid diet is to have 3 meals and 2 to 3 snacks every day, drink 1 protein shake every day, and sip on water and other low-calorie beverages in between your meals and snacks all day long. On the menus, you'll notice that the evening snack is as needed. If you feel hungry, if you're waking up at night feeling hungry, or if your energy is lower than usual, an evening snack is suggested. This will also help you to increase your protein intake. During this menu, your portion goal is set at about a half cup of food per sitting. But half a cup will likely be too much food in the beginning. It's very normal to only be able to fit in 3 sips at breakfast, 7 small spoonfuls at snack, and 5 spoonfuls at lunch. Even if you don't feel hungry, it's important to try and eat. Even a few spoonfuls or a couple of sips is better than nothing, so focus on doing your best. The full fluid menu includes a variety of foods that are liquid, high in protein, and easy to digest. Options include hot cereal like oatmeal, yogurt, milk-based soups, or lentil-based soups. If you feel discomfort while eating, take smaller spoonfuls, wait longer in between bites, and listen more closely to your stomach. You may find it helpful to eat with a baby spoon, espresso spoon, or teaspoon to control the amount of food that you're eating at once. It's also important to note that your meals and snacks need to be very smooth in order for you to tolerate them, and you don't want any chunks. If you feel that your choices are too thick or have pieces, put them in the blender again and thin them out with milk, water, or broth. You may notice that there's little to no fruits or vegetables included in this menu during this phase. Fruits and vegetables will be introduced in the next menu, which is the puree menu. So over the next 2 weeks, take your time, listen to your new stomach, focus on your protein, and on staying hydrated. If you're having major tolerance issues, speak with your registered dietitian who can help with this. Refer to the written content provided for the full fluid menu and for more detailed instructions for what to eat and how to eat during the first 2 weeks after surgery.